Velkommen. Mit navn er Tengbjerg. Jeg driver Tengbjerg Sundhedsuddannelser, hvor vi uddanner massageterapeuter, akupunktører og zoneterapeuter. Det vi laver her er en videopodcast til Massørnyt, som er et online nyhedsbrev for netop massører, zoneterapeuter, akupunktører og andre manuelle behandlere. Vi har valgt at lave nogle interviews, som kan høres her på siden, så behandlerne kan vælge at modtage deres inspiration og idéer, mens de pusler med dagligdags ting. Yeah. Welcome to Khatuna Urushadze from Georgia. I met Khatuna in Moldova last year, where we both were judges. Actually, it was in 2019, but it was in Moldova, Chisinau, where we both were judges at the Euro Asia and Massage Championships. And we talked not only about massage, but also about acupuncture, because I found out that Khatuna was actually an expert in this area. So this is why I have invited Khatuna to tell a little bit about acupuncture. Welcome, Khatuna.
Thank you very much. Hello, Jeppe. Thank you for invitation and for your interest in acupuncture. Let me to wish you Happy New Year. Wishing a safe, healthy, and prosperous New Year. Thank you very much.
Thank you. Vice versa. Please, could you, so we know more about you? I know that you are the president of the Georgian Association of Acupuncturists, and you are also the co-founder of the Georgian Professional Massage Association. But could you please tell me more about your CV?
So this is, shortly I can say that I'm practitioner acupuncturist. Also, I'm lecturer at medical university. Also, I'm giving lectures at Acupuncture Association Educational Center for different kind of professions. This is acupuncture, this is massage therapy, different kind of massage therapy. And also I have my private school where I'm giving also lectures, and also I am author of acupuncture and massage books in Georgian. This is shortly. I have a lot of qualifications in different countries, and also in China, in Beijing, traditional medicine clinics. So it's enough, I think.
You are qualified.
Thank you.
And I knew from the beginning that you were qualified, and I would like to ask you about Georgia and acupuncture. For example, how is acupuncture really used in Georgia? And I mean, is it a protected title? Is it only a physiotherapist who's giving it, or how does this work?
So acupuncture is in Georgia belongs to the field of postgraduate medical education. I know that in different countries, different laws about this, but in Georgia like this is postgraduate medical education. What means that doctors already know the basic medical subjects: anatomy, medical physiology, pathology, physical diagnosis, clinical sciences. So after this, we give just exact acupuncture education in our centers because of, according of the regulation, this is postgraduate medical qualification. So in Georgia, we have different kinds, commonly practiced in Georgia, the kind of acupuncture techniques. These are TCM, traditional Chinese medicine, corporal acupuncture. I will explain a little bit later what does it mean. Ear acupuncture, also Yamamoto new scalp acupuncture, Sujok acupuncture, and also in our days it's starting very, very popular dry needling. So let me to define distinct and unique characteristic of each medical acupuncture modality. What does it mean, each one? Simply, TCM acupuncture is defined as a type of acupuncture which is based on the basic knowledge of traditional Chinese medicine theories. Corporal acupuncture is defined as a type of acupuncture which is based on the system of channels and collaterals. So 12 ordinary channels connecting to the internal organs and biologically active points which are located on these channels and collaterals. Ear acupuncture, also known as auricular acupuncture therapy, is based on the principle of traditional medicine that ear is not a separate organ, but closely connecting to the channels and collaterals and downful organs. So downful organs, these are internal organs, internal organ names to the classical anatomy. And ear acupuncture, ear is as part of the body, as an organic whole. Distribution of auricular points is just like an inverted fetus on ears. So Yamamoto New acupuncture, scalp acupuncture, is a complete acupuncture microsystem on the head, before and behind the ears, representing the entire body in small size. This is Japanese system. Sujoku acupuncture, this is much more Korean system of acupuncture. This is corresponding system representing to the whole body on the hands and on the feet. And dry needling, or we call this trigger points dry needling, becoming more and more popular in Georgia today. It should be noted that these methods are different, but the philosophical and theoretical basis unites them, and they are derived from each other. So these are kinds of acupuncture what we use in Georgia.
I think it's we have similar ways to do so. We use a lot of dry needling, and also just follow the Chinese traditional Chinese medicine. And we have a system called local, distal, special, and we use it a lot because it's good for pain killing, really, but also many other things. Do you know the system and what I mean when I say local, distal, special?
Sorry, can you repeat? What?
Do you know, to understand what I mean when I say local, distal, special treatments?
Yes, of course, of course.
What does this mean for you?
Biologically active points can divide it on the proximal and distal points. So distal points, they are located below the elbow and knee joints, and other points are all proximal points. So according to the indications, distal points are much more therapeutically effective points because of between distal points which are located below the elbow and knee joints, we have some specific points. These are tonification, these are sedative, these are source U1 point, this is connecting luo point, also this is analgetical C cleft point. So besides of this, on each channel we have two main points also. This is front diagnostic mo points. It's a Chinese name, as you understand, mo points, and spinal back shu points. So these 2 points, diagnostic and back shu points, they have exact location. So diagnostic points, they are located on the front body, and back shu points, they are located on the spinal innervation zones. But other points, these are specific points, and also between distal points, we have very, very important points, which we call 5 elements points. They are much more therapeutically effective points, which we use to to give individual prescription for the patients. Other points, they are proximal points, and they more have local indications. Also, by the investigation, it is shown that 92% of biological active points, they are the same with trigger points. So these proximal points also become as a trigger points in pain syndrome of when muscles becoming tight and painful. So therapeutically, to treat internal organs, much more we use distal points, but all other points, as well as distal points, they have also local indications. That means that the points can be used for the problems of each structure. These are skin, under skin tissue, this is blood vessels, nerve strokes, where the points are located. So that means for me, distal and local points. So specific points, as you mentioned, this is also Wushu points. Wushu, this is 5 elements points. Wu in Chinese 5, as you know. And special points also, this is diagnostic front mo point and spinal backshoe points. Besides of this, we have some different groups of special points, but this is a long speak for this.
Yeah, I think it's for us, it's interesting to know how you do it in other countries, of course. And we do it like this, that we also use the backshoe points and the move points on the front, and then we have what we call local and distal, and local is where the pain or the illness is, and distal is of course distal. And then we have the special, and special points could be the 5 element points to push the energy around in the 5 elements and make it in balance and so on. So I think we use similar terms and think more or less alike at this point. And you also talked about dry needling, this where you use trigger points. Can you, in your opinion, use both systems? I mean, the Western trigger point system and the traditional Chinese medicine. Can you combine this treatment?
Of course. So for treatment, we use integrative approach to the body. So this is, in my opinion, this is very important to combine integrative methods of traditional and classical medicine. Classical diagnosis, to interpret classical diagnosis into energetical diagnosis. Also, this is very important. For this, we use also both methods. This is, so when we investigate the patient, we have 2 main questions. This is where the problem, in which energy we have imbalance, and second, this is what kind of imbalance. So nature or the disease according of yin yang and energy differentiation. So when I'm talking about energy differentiation, I mean, of course, 5 elements theory. Also, we call this 6 energy theory, because of, as we know, everything is divided according to the 5 elements and also energies. So because of in fire element, we have 2 energies, warm and hot. 5 elements theory, at the same time, we call 6 energy theory. So this is very important to use integrative investigation plan. Clinical methods of modern medicine, the history, physical, laboratory, and instrumental examinations, and 4 diagnostic methods of traditional medicine. This is in Chinese, Wan, Wen, Wen, Che methods. So diagnosis and treatment includes importance of integrative methods. The goal of the training, also what we are giving for our students, this is to put correct diagnosis according to the integrative methods, classical and traditional. So of course we use Western and traditional approach for this. We use laboratory and instrumental investigation, and at the same time also we use traditional techniques, between them also tongue diagnostic and pulse diagnostic too.
We also use tongue diagnostic, but not so much pulse really, because it's it brings me to our next topic really. It's about education really, and because in Denmark, let me tell you how we develop the education. In Denmark, we have only 250 lessons in Chinese medicine, including a lot of practice. And then we have 200 hours of anatomy and physiology, 100 hours of pathology, we have 50 hours of psychology and clinical management, we have 10 lessons. And then we have something called alternative therapies, 50 lessons. So, but my point is here that we only have 250 lessons. And please, your education, how many hours do you have?
So I don't know how is law in your country about acupuncture. This is, as in Georgia, this is postgraduate medical education, or any person can learn acupuncture?
In Denmark, everybody can learn.
So if everybody can learn, of course, your program is very good because of anatomy, physiology. This is very important for learning acupuncture. But as I mentioned above, acupuncture in Georgia belongs to the field of postgraduate medical education. That means that doctors already know everything about the basic subjects, about the clinical sciences. So that's why considering to this, training courses includes about 500 hours of theoretical and clinical training exactly in acupuncture. Educational program includes learning of history and philosophy of Chinese medicine, includes also introduction of Chinese classical texts and modern scientific studies on the mechanism and action of acupuncture. The basic knowledge of traditional medicine, as you know, it includes the theories of yin yang, 5 elements, Zanfu, channels and collaterals, qi, blood and body fluids, etiology, methods of diagnosis, and differentiation of syndromes. So this is exactly acupuncture learning. But according to this, the doctors already know anatomy, physiology, and other subjects too. These are 500 hours of theoretical and clinical training.
Yeah, so my point is that in Georgia, the acupuncture therapists have more lessons, really more experienced, can work on a higher level than in Denmark. But I would like you to consider something. If you should recommend methods and approach for acupuncture for the Danish therapist who has only 250 lessons. I mean, we have to bring the treatment to a level that suits this kind of education level. So my problem is, how difficult should we make the education? At what level should we give acupuncture in? For example, I have chose pulse diagnosis a little away because it's quite difficult to learn and it takes a lot of time, and we have more or less only 250 lessons. But what do you think is important if you only have 250 lessons to learn?
So for acupuncture treatment, to reach the effect in treatment, these are very important. Of course, these are the things to diagnose them, etc. But let's give diagnosis to the doctors. So if the person who has already diagnosis, So person should know, first of all, to locate biologically active points very well. So location of biologically active points is very, very important. So according to the anatomy, according to the innervation, according to the blood vessels, according to the internal organs, dermatome, mytome, sclerotome, dermatome. So this is very important. Relationship between points and parts of the body. So first of all, this is direct location of the points according to the different techniques how to locate the points. This is thumb measurement, this is finger measurement, this is anatomical landmarks, this is lines. So it should be, of course, it's very important to give direct location of the points. Second is very important to know Chinese needles and needling techniques. So as we know, Chinese needles also are different sizes, different diameters. So according to the body, it should be chosen by different way. And also we should know different kind of characteristics of needles and also needling techniques. Needling techniques, to learn needling techniques, it is not so difficult. The person should be trained in this field. So this is place, this is depth, this is direction according to the energy circulation in meridians. This is, of course, timing, how long to leave the needles in biologically active points. And also some breathing stages have some role for needling techniques, and also how to insert and how to take the needle from the point. So needling techniques, this is very important. What more? Location and needling technique. This is much more important.
I agree.
To know. But as I mentioned above, so if the doctor is doing acupuncture, of course, doctor puts the integrative diagnosis. But these persons who can learn acupuncture without medical background, so the person should come with diagnosis, because of they can't put diagnosis just only by knowing the points location and needling technique. But you know that this is traditional medicine, and according to the tradition, we have already combination of the points which we can use in all patients. But when we are talking about individual approach and prevalence of traditional medicine in this, that we treat individually, of course, should be choose the points according to the individual status to balance body to the universe and balance body inside of the body between physical, mental, and emotional. So we can use already the points combination which we know from books.
And I think I agree, and I think the schools in Denmark more or less agree as well, and they try to find what is important. Of course, the location of the points and the understanding of the needling, how you use it, the needles, and how you tonify and not tonify really, and also, of course, the diagnostic thing is kind of difficult, because it's very easy. You can do it wrongly, really, because the symptoms can become because of other problems really. And then you stay blind on one thing, but it is actually something else. So I think that the diagnosis thing is very difficult, especially if we only have 250 lessons, but it has to be part of the education. And I think the most important thing is really to know your limits, where which kind of cases you can help with and which you should not touch, and maybe give it to more skilled people or to doctors and so on. Anyway, in your experience, how do you use acupuncture? What is it good for really? Because of course we can say, well, you can use acupuncture for everything. But is it really like that? Or is it good for something and less good for other things?
Yes. So as you mentioned above, of course, the diagnostic process of this is very, very difficult. And the main principle of medicine, not to hurt the patient, non nocere in Latin, yes? So that's why let's give this possibility to the doctors. How and when to use acupuncture? So officially, we know that the National Institute of Health and the World Health Organization formally recognize acupuncture as a method of pain relief. And National Institute of Health advisory panel has concluded that acupuncture is a useful treatment for fibromyalgia, headache, asthma, and other conditions. Between my patients, a lot of patients with menstrual dysfunction, also with vertebral problems, disc degenerative disease. Hundreds of acupuncture studies also are underway to determine just how effective acupuncture may be for conditions ranging from arthritis to chronic fatigue syndrome. So these are the main diseases when we use acupuncture. So between my patients, as I mentioned, this is a lot of cases of migraine, headache, pain for pain relief because of different kind of problems. Also gynecological problems in women. So also for musculoskeletal system problems, we use acupuncture very well with great effect.
It is of course similar in Denmark. We also have these experiences, but I think one more thing is that it could be interesting for our students to hear how a consultation at your place is. How do you do that? And I mean, from they come into your practice and into the leave, what is the procedure really?
So because of I'm a doctor, internal medicine doctor. So as I mentioned above, also I use integrative investigation plan, clinical methods of modern medicine, and also traditional Chinese methods. I use all theories. These are for diagnose the patient energetically. So these are all theories in Yan, Zangfu, 5 elements, Qi, blood and body fluids. And also, as you know, this is very important to use Chinese meridian clock. Because of the main thing in traditional medicine, to balance the body, to find the balance between body and the universe as a microcosm in macrocosm and inside of the body. Chinese body clock help us to choose appropriate regime to balance the body to the universe. And these all theories of traditional medicine give us possibility to find balance inside of the body. So critically important, correct energetical diagnosis. So I'm putting first of all energetical diagnosis. So what I talked about, we are the problem and what kind of problem energetically, according to the 5 elements or 6 energies. After I'm choosing individual prescription of the biologically active points for each person and going to the sessions. How many sessions it should be done and how often it should be done. So this is up to the problem. I'm working like this. If the problem is acute, in this case, I'm giving, for example, 5 or 7 sessions every day, and after rarely twice a week or once a week, when I'm receiving pain relief and I'm receiving improvement in the patient's condition. And also giving some recommendations how to balance yourself with the universe, how to choose feeding regime, sleeping regime, liquid taking regime. These up to the Chinese meridian clock. So like this.
It's interesting, the meridian clock, also to think about that and consider what to eat and what kind of herbs could improve
when
the person.
To eat.
And when to eat, yeah. Also, when to go to toilet and so on.
Yes.
yeah. Very interesting. And then I think it's very similar. Yeah, I think I would like to say thank you for giving your thoughts and ideas and telling us how the education is in Georgia and what to expect from a Georgian acupuncture therapist. You have, we are impressed of the level. Actually, I think it's very ambitious, and it's in Denmark. We also want to be ambitious about it, the education system. We are, but it is a private education, so students have to pay themselves, and it's actually a lot of money. How does that work really in Georgia? Do the students have to pay themselves?
Of course. This is also private courses, and the students, they should pay for this education. But I think that this is not so expensive as in Denmark.
No, but it's most likely similar to the income also. So it's probably the same problems you have. Did you teach in acupuncture elsewhere than in Georgia?
Yes, I'm teaching. I give lessons, private lectures in Turkey. Because of, as I mentioned, I'm lecturer at Tbilisi State Medical University, and there are a lot of foreign students and exactly Turkish students. So they invite me after finishing university, and I'm giving some. So I gave these lectures, but unfortunately now it's impossible in Turkey. And also, as I mentioned, at our university, a lot of foreign students. So they are coming to me in our association. They are from India, from different Oriental countries, from Europe as well as, and we are giving these private courses for these foreign students. But the country where I'm giving lectures, this is exactly the Turkey.
I think it's this kind of teaching really that online teaching. It has its benefits. Of course, it has its problems regarding the practical issues. But I think we have good experiences regarding the theory, learning the theory, sitting at home, doing it on Zoom or Teams or whatever kind of program we are using. Is it also your experience that you can learn a lot of theory online?
Yes, in these days I'm giving online lectures, but I want to say that I don't like online lectures. This is very difficult because of it's much more easier to communicate with students and showing the point, showing the technique. It's impossible to give appropriate knowledge by online. Of course, some of the theories you can give online and explain this online, but this exactly practical training. So practical subjects to give online, this is very, very difficult. And in my opinion, I think that it don't has effect as offline education, of course.
I totally agree again. There are many things that works online, and then there are something that doesn't work really good. That is my experience also. What else can we add? I think we have some students here. They are hungry for knowledge, and they're sitting at home and are locked down at this moment. What else to tell? What about
theoretical knowledge? Of course, it's very easy to give online theoretical knowledge. And theory, this is, as we mentioned, also you agree with me, and I agree with you that theoretical knowledge, philosophy of traditional medicine, this is very, very important. Very important. So it may be given by the online regime, but other kind of questions like point location, needling technique. Of course, this is exactly practical experience.
Yeah, and again, I agree. All right, we could talk for many hours. I'm thinking I will round up, and then maybe we can have another chat at another time. Thank you again for sharing. It has been a pleasure.
Thank you very much again for invitation, and I wish you all colorful life as 5 elements, and to keep the dynamic balance in everything as in yang. Thank you very much. I hope that we will meet each other again, not just only online, but offline too. Thank you very much, Jeppe.
Kære lytter, tak fordi du lyttede med. Kom gerne med forslag til, hvad denne podcast kunne tage op af emner. Tilmeld dig Massørnyt på Tengbjerg.dk og få løbende tilsendt spændende artikler og podcast om inspirerende mennesker fra Danmark og fra udlandet, som vil fortælle om spændende behandlingsmetoder, og grib muligheden for at teste dig selv af med en af vores mange quizzer inden for anatomi, fysiologi og sygdomslære, eller om massage, zoneterapi og akupunktur. Du kan også følge skolens Facebook-side Tengbjerg Sundhedsuddannelser og finde mere inspiration. Tak for denne gang.